Question 1. A pharmacy technician receives a prescription for oxycodone. Which DEA schedule is oxycodone classified under, indicating its high potential for abuse and dependence? A. Schedule 2. B. Schedule 3. C. Schedule 4. D. Schedule 5. Answer: A. Schedule 2. This question tests knowledge of controlled substance classifications, specifically the Drug Enforcement Administration, DEA, schedules. The keyword high potential for abuse and dependence is a crucial clue, pointing directly to Schedule 2 medications. Schedule 2 drugs, like oxycodone, have the highest abuse potential among federally regulated substances with accepted medical use and require strict handling and record keeping. For example, these prescriptions often cannot be refilled and may require a new written prescription each time. Remember that Schedule 2 drugs have the highest abuse potential of any drug with accepted medical use, making them top priority for careful handling. Question 2. A patient brings in a prescription for Synthroid 50 micrograms, to be taken IPQD. The pharmacy dispenses 90 tablets. How many days will this supply last? A. 30 days. B. 60 days. C. 90 days. D. 180 days. Answer: C. 90 days. This question assesses the ability to interpret prescription directions and calculate the day's supply. The crucial keyword is IPQD, which translates to 1 by mouth daily. To determine the day's supply, simply divide the total quantity dispensed by the number of doses taken per day. In this case, 90 tablets divided by 1 tablet per day equals 90 days. Always pay close attention to the dosage instructions when calculating day's supply, as this directly impacts patient adherence and medication safety. Question 3. Which of the following federal acts requires patient consent for the use and disclosure of protected health information, PHI? A. Poison Prevention Packaging Act, PPPA. B. Occupational Safety and Health Act, OSHA. C. Health Insurance Portability and Accountability Act, HIPAA. D. Drug Quality and Security Act, DQSA. Answer: C. Health Insurance Portability and Accountability Act, HIPAA. This question evaluates understanding of key federal laws governing pharmacy practice, specifically regarding patient privacy. The important keywords patient consent and protected health information, PHI, directly refer to the core provisions of the Health Insurance Portability and Accountability Act, HIPAA. HIPAA sets national standards for protecting sensitive patient health information from disclosure without the patient's consent or knowledge. For example, a pharmacy technician cannot share a patient's medication list with their family member without the patient's explicit permission. Always remember that HIPAA is the cornerstone of patient privacy in healthcare, requiring careful handling of all patient information. Question 4. When preparing sterile compounds in a laminar airflow workbench, what is the correct order for donning personal protective equipment, PPE? A. Gown, mask, gloves, hair cover. B. Hair cover, mask, gown, gloves. C. Mask, hair cover, gown, gloves. D. Gloves, mask, hair cover, gown. Answer: B. Hair cover, mask, gown, gloves. This question tests knowledge of aseptic technique and proper garbing procedures essential for sterile compounding. The concept being tested is the proper sequence to minimize contamination when entering a clean room or preparing sterile products. Beginning with the least shedding items like a hair cover and mask, then the gown, and finally sterile gloves ensures that cleaner items are donned before those that touch sterile surfaces. For example, donning gloves last helps maintain their sterility until just before handling sterile components. Always remember to don PPE from dirtiest to cleanest areas of the body or from items that shed the least to those that shed the most. Question 5. A pharmacy technician identifies that a prescription is for atorvastatin. This medication belongs to which drug class? A. Beta blockers. B. ACE inhibitors. C. Statins. D. Diuretics. Answer: C. Statins. This question assesses basic pharmacology knowledge, specifically drug classifications by suffix. The keyword atorvastatin contains the common suffix statin, which is a strong indicator of its drug class. Statins are primarily used to lower cholesterol levels in the blood, reducing the risk of cardiovascular disease. For instance, other medications like simvastatin and rosuvastatin also share this suffix and function similarly. Recognizing these common suffixes helps quickly identify a drug's class and general purpose. Question 6. A pharmacy receives a new shipment of insulin. To minimize waste and ensure product quality, which inventory management principle should be followed when stocking the shelves? A. Last in, first out, LIFO. B. First in, first out, FIFO. C. Just in time, JIT. D. Economic order quantity, EOQ. Answer: B. First in, first out, FIFO. This question tests understanding of essential inventory management principles in a pharmacy setting. The keywords minimize waste and ensure product quality are crucial clues, indicating the need to use older stock before newer stock, especially for perishable items like insulin. The first in, first out, FIFO method ensures that products that arrive first or have earlier expiration dates are dispensed first, reducing spoilage and preventing medications from expiring on the shelves. For example, placing newly arrived medication behind existing stock with older expiration dates helps implement FIFO effectively. Always remember that FIFO is crucial for managing medications with expiration dates to ensure patient safety and reduce financial loss. Question 7. A prescription indicates take 1 tablet per BID PRN pain. What does the abbreviation BID mean? A. Before meals. B. Every other day. C. Twice a day. D. At bedtime. Answer: C. Twice a day. This question evaluates knowledge of common medical abbreviations used in prescriptions. The abbreviation BID is a frequently used Latin abbreviation in pharmacy to indicate the frequency of medication administration. Understanding this abbreviation is critical for accurate dispensing and patient counseling. For example, if a patient is prescribed a medication BID, they would take it once in the morning and once in the evening. Always memorize common abbreviations like BID to ensure correct interpretation of prescription orders. Question 8. Warfarin is considered a high-alert medication. What is the primary reason medications are classified as high-alert? A. They are expensive. B. They are only available through a special access program. C. They have a high risk of causing significant patient harm when used incorrectly. D. They are frequently involved in drug-drug interactions. Answer: C. They have a high risk of causing significant patient harm when used incorrectly. This question assesses understanding of medication safety concepts, specifically high-alert medications. The concept being tested is why certain medications are designated as high-alert, which is due to their inherent risk. The primary reason is that these medications carry a heightened risk of causing severe patient injury or even death if they are misused or if errors occur during their administration. For example, an incorrect dose of warfarin can lead to life-threatening bleeding. Always remember that extra caution and specific safety protocols are required for high-alert medications to minimize serious patient harm. Question 9. Which of the following is not a required component of a valid prescription? A. Patient's full name. B. Prescriber's DEA number, if controlled substance. C. Patient's insurance information. D. Drug name, strength, and dosage form. Answer: C. Patient's insurance information. This question tests knowledge of the essential elements that constitute a legally valid prescription. The keyword "not a required component" directs you to identify the element that is not legally necessary for the prescription itself to be valid. While patient insurance information is crucial for billing and payment, it is not a legal requirement for the prescription to be filled by a pharmacist. Essential components include patient demographics, drug details, directions, prescriber information, and signature. For example, a cash-paying patient's prescription still requires all other details except insurance. Always remember the core information legally required on a prescription versus information needed for processing or payment. Question 10. A pharmacy technician prepares a non-sterile compound. According to USP less than 795 guidelines, what must be assigned to the compounded preparation? A. An NDC number. B. A specific beyond use date, BUD. C. A DEA registration number. D. A Universal Product Code, UPC. Answer: B. A specific beyond use date, BUD. This question evaluates understanding of compounding guidelines, specifically related to non-sterile preparations and their stability. The concept tested is the importance of assigning a beyond use date, BUD, to compounded preparations to ensure their stability, potency, and safety. The keyword USP less than 795 guidelines indicates adherence to official standards for non-sterile compounding. Unlike manufactured drugs that have expiration dates, compounded preparations require a BUD calculated based on the stability of ingredients and storage conditions. For example, a compounded cream might have a BUD of 30 days when stored at room temperature. Always remember that assigning an accurate BUD is critical for patient safety with compounded medications. Question 11. Which DEA form is used to order Schedule II controlled substances? A. DEA Form 41. B. DEA Form 106. C. DEA Form 222. D. DEA Form 224. Answer: C. DEA Form 222. This question tests knowledge of specific Drug Enforcement Administration, DEA, forms used in managing controlled substances. The critical keyword is Schedule II controlled substances, as these have the strictest ordering requirements. DEA Form 222 is a special triplicate form required by the DEA for the ordering, transfer, and return of Schedule II controlled substances, ensuring accountability. For example, a pharmacy must use this form to order fentanyl patches or oxycodone tablets from a distributor. Always remember that DEA Form 222 is uniquely associated with the procurement of Schedule II medications due to their high abuse potential. Question 12. A prescription reads Instill 2 GTTSOUQHS. What does OU refer to? A. Left ear. B. Both eyes. C. Right eye. D. Both ears. Answer: B. Both eyes. This question assesses knowledge of ophthalmic and otic abbreviations crucial for accurate medication administration. The abbreviation OU is a Latin abbreviation specifically referring to oculus uterque, meaning both eyes. Misinterpreting this abbreviation could lead to administering medication to the wrong organ or not administering it to the correct one. For example, eye drops prescribed OU should be given in both eyes, not just one. It's essential to differentiate OU, both eyes, from OS, left eye, and OD, right eye, to ensure patient safety. Question 13. A patient's insurance claim is rejected with the message "refill too soon." What is the most likely reason for this rejection? A. The medication is not covered by the plan. B. The patient has not met their deductible. C. The patient has not used a sufficient amount of their previous fill. D. The prescription requires a prior authorization. Answer: C. The patient has not used a sufficient amount of their previous fill. This question tests understanding of common insurance rejection codes in pharmacy billing. The specific rejection message, "Refill too soon," is a clear indication of the reason. This rejection typically means that, according to the insurance plan's calculations, the patient should still have enough medication from their previous fill to last until the current refill date. For example, if a patient filled a 30-day supply 20 days ago, the insurance will likely reject a new fill as too soon. Understanding this rejection helps the technician explain the issue to the patient or pharmacist. Question 14. Which of the following drugs requires a risk evaluation and mitigation strategy, REMS, program due to its severe adverse effects, such as birth defects? A. Amoxicillin. B. Ibuprofen. C. Isotretinoin. D. Metformin. Answer: C. Isotretinoin. This question assesses knowledge of specific drug safety programs, particularly risk evaluation and mitigation strategies, REMS. The keyword severe adverse effects, such as birth defects, is a strong indicator of a drug that would necessitate a REMS program. Isotretinoin, used for severe acne, is highly teratogenic, causes birth defects, and requires the iPledge REMS program to ensure safe use, including mandatory pregnancy testing and registration. For instance, patients must enroll in this program and meet specific criteria before receiving the medication. Always remember that REMS programs are designed to mitigate risks associated with certain medications that have serious safety concerns. Question 15. To prevent medication errors, a pharmacy technician should be especially cautious when distinguishing between which two medications due to their similar names? A. Lisinopril and amlodipine. B. Metformin and glipizide. C. Celebrex and Celexa. D. Warfarin and Eliquis. Answer: C. Celebrex and Celexa. This question tests awareness of lookalike/soundalike, LASA, medications, a critical aspect of medication safety. The concept involves identifying drug names that appear or sound similar but are entirely different medications, posing a high risk for dispensing errors. Celebrex, celecoxib, an NSAID, and Celexa, citalopram, an antidepressant, are classic examples of LASA drugs that often lead to confusion. For example, a misread prescription or hurried verbal order could easily result in the wrong drug being dispensed. Always double-check LASA medications, often marked with tall man lettering, to prevent dangerous errors. Question 16. What type of dosage form is designed to release the medication slowly over an extended period, allowing for less frequent dosing? A. Immediate release tablet. B. Suppository. C. Extended release capsule. D. Suspension. Answer: C. Extended release capsule. This question assesses understanding of various dosage forms and their release characteristics. The keywords "slowly over an extended period" and "less frequent dosing" clearly describe the purpose of an extended release dosage form. Extended release, ER, XR, XL, SR, CR, formulations are designed to maintain a relatively constant drug concentration in the body, which improves patient compliance by reducing the number of daily doses. For example, a medication taken once daily as an extended release form might otherwise need to be taken 3 or 4 times a day if it were an immediate release form. Always recognize that extended release forms are designed for convenience and consistent drug levels, and should never be crushed or chewed. Question 17. During sterile compounding, What is the purpose of wiping down the exterior of vials and ampoules with an alcohol swab before entering the laminar airflow workbench, LAFW? A. To remove the manufacturer's label. B. To sterilize the surface of the container. C. To prevent contamination from particulate matter or microorganisms. D. To check for cracks or damage to the container. Answer: C. To prevent contamination from particulate matter or microorganisms. This question tests knowledge of aseptic technique protocols in sterile compounding. The concept is called disinfection, and it's a critical step to maintain the sterile environment inside the LAFW. Wiping the exterior of vials and ampoules with 70% isopropyl alcohol removes any surface contaminants, such as dust, dirt, or microorganisms, that could otherwise be introduced into the sterile preparation. For example, if a vial isn't wiped, dust particles on its surface could fall into the sterile solution during manipulation. Remember that this cleaning step is essential for reducing the risk of microbial contamination in sterile preparations. Question 18. A patient needs 250 milligrams of a medication, and the pharmacy only has 1 gram tablets available. How many tablets should the technician dispense? A. 0.25 tablets. B. 0.5 tablets. C. 1 tablet. D. 4 tablets. Answer: A. 0.25 tablets. This question tests the ability to perform basic pharmaceutical calculations, specifically unit conversions and dosage calculations. The key is to first convert the available tablet strength from grams to milligrams, remembering that 1 gram equals 1,000 milligrams. So, 1 gram tablets are 1,000 milligrams tablets. Then, divide the desired dose, 250 milligrams, by the strength of each tablet, 1,000 milligrams, to find the number of tablets needed. 250 milligrams / 1,000 milligrams equals 0.25 tablets. Always ensure units are consistent before performing calculations to avoid errors. Question 19. A patient asks a pharmacy technician for medical advice regarding their symptoms. What is the most appropriate response for the technician? A. Provide general advice based on common knowledge. B. Direct the patient to the pharmacist for consultation. C. Suggest searching for information online. D. Recommend specific over-the-counter medications. Answer: B. Direct the patient to the pharmacist for consultation. This question evaluates understanding of the professional scope of practice for a pharmacy technician and ethical boundaries. The concept being tested is that pharmacy technicians are not licensed to provide medical advice or counseling on symptoms or drug therapy. The keywords medical advice and symptoms clearly indicate a role reserved for a licensed pharmacist or other healthcare professional. For example, a technician should tell the patient, "I'm not qualified to give medical advice, but the pharmacist would be happy to speak with you." Always remember to refer patients with clinical questions to the pharmacist, as this upholds professional standards and patient safety. Question 20. A medication states store at controlled room temperature. What temperature range does this typically refer to? A. 0 to 5 degrees Celsius, 32 to 41 degrees Fahrenheit. B. 2 to 8 degrees Celsius, 36 to 46 degrees Fahrenheit. C. 20 to 25 degrees Celsius, 68 to 77 degrees Fahrenheit. D. 30 to 40 degrees Celsius, 86 to 104 degrees Fahrenheit. Answer: C. 20 to 25 degrees Celsius, 68 to 77 degrees Fahrenheit. This question assesses knowledge of proper medication storage conditions, which is crucial for maintaining drug efficacy and stability. The concept of controlled room temperature refers to the typical ambient temperature found in a pharmacy or home setting. This specific range is defined by the United States Pharmacopoeia, USP, to ensure drug quality and prevent degradation. For example, storing a medication outside this range, like in a hot car, could render it ineffective or even harmful. Always remember that specific temperature ranges are essential for preserving medication integrity. Question 21. In a typical pharmacy workflow, which step immediately follows the data entry of a prescription? A. Dispensing/filling. B. Patient counseling. C. Pharmacist verification/DUR. D. Insurance adjudication. Answer: D. Insurance adjudication. This question assesses understanding of the standard workflow in a retail or outpatient pharmacy. The keyword immediately follows is important to identify the next sequential step after a prescription has been entered into the pharmacy's computer system. Once the data entry is complete, the system automatically attempts to process the claim through the patient's insurance for payment, which is known as adjudication. For example, if the insurance rejects the claim, the technician would then address the rejection before proceeding to filling. Knowing the order of operations helps in efficient and accurate processing of prescriptions. Question 22. Which of the following actions is a crucial patient safety measure when dispensing a prescription? A. Asking the patient for their preferred payment method. B. Verifying the patient's full name and date of birth. C. Telling the patient the pharmacist is busy. D. Estimating the patient's copay without checking. Answer: B. Verifying the patient's full name and date of birth. This question tests knowledge of essential patient safety measures in the dispensing process. The concept being tested is patient identification, which is paramount to prevent medication errors. Verifying at least 2 patient identifiers, such as full name and date of birth, ensures the correct medication is given to the correct patient, avoiding potentially life-threatening mix-ups. For example, if 2 patients have the same last name, confirming the date of birth prevents dispensing the wrong prescription. Always prioritize confirming patient identity to safeguard against medication errors. Question 23. What term describes the electronic process by which a pharmacy submits a claim to a third-party payer, e.g., insurance company, for payment and receives a response? A. Prior authorization. B. Adjudication. C. Coordination of benefits. D. Reimbursement. Answer: B. Adjudication. This question assesses understanding of billing and reimbursement terminology in pharmacy. The keywords electronic process, submits a claim, and receives a response precisely define the term adjudication. Adjudication is the real-time process where an insurance company reviews a pharmacy claim against the patient's benefits and determines coverage, co-payments, and payment to the pharmacy. For example, when a pharmacy technician enters a prescription and hits process, the system performs adjudication. Understanding adjudication is key to resolving billing issues and ensuring timely payment for services. Question 24. What is the primary function of a horizontal laminar airflow workbench, LAFW, in sterile compounding? A. To measure precise liquid volumes. B. To provide a sterile environment for compounding by filtering air across the work surface. C. To heat and cool compounded solutions. D. To store sterile supplies at a controlled temperature. Answer: B. To provide a sterile environment for compounding by filtering air across the work surface. This question assesses knowledge of critical equipment used in sterile compounding. The concept is the core purpose of a laminar airflow workbench, LAFW. The primary function of an LAFW is to create an ISO Class 5, Class 100, clean environment by continuously filtering room air through a high-efficiency particulate air, HIPAA, filter and directing it smoothly over the work surface, preventing airborne contamination. For example, This filtered airflow protects sterile products from particles and microorganisms present in the surrounding air. Always remember that the LAFW is essential for maintaining sterility during the preparation of sterile intravenous solutions and other sterile compounds. Question 25. A patient calls to request a transfer of their prescription from another pharmacy. Which of the following is true regarding prescription transfers? A. Pharmacy technicians can legally transfer controlled substance prescriptions. B. Only pharmacists or certified pharmacy technicians can transfer non-controlled prescriptions. C. Transfers for controlled substances, Schedules 3V, can only occur once. D. All prescriptions can be transferred multiple times without restriction. Answer: C. Transfers for controlled substances, Schedules 3V, can only occur once. This question tests knowledge of pharmacy law regarding prescription transfers, particularly for controlled substances. The concept being tested is the federal regulations governing the movement of prescriptions between pharmacies. For Schedule 3, 4, and V controlled substances, federal law dictates that they can only be transferred one time between pharmacies for refilling purposes. For example, if a patient transfers their Adderall, CII, prescription to a new pharmacy, it can only be transferred once, and a new prescription would be required for any further transfers. Remember that strict rules apply to controlled substance transfers to prevent diversion and ensure accountability.